Hello everyone, I am Dr. Varun Mamidi, consultant nephrologist at Asian Institute of Nephrology and Urology, High-Tech City branch, Hyderabad. Today I am going to talk about the topic, how to prevent delay in progression of chronic kidney disease. So first, patients with chronic kidney disease are diagnosed using few simple blood tests like blood urea and serum creatinine. So first we'll understand few basic concepts. So first thing is this urea and creatinine are produced in the body by digestion of the food we eat. So whatever food we take contains carbohydrates, proteins, fats, vitamins and minerals. So these things are digested in the body and then some waste products are released into the blood such as urea and creatinine. So this urea and creatinine which is in the blood usually is filtered in the kidneys and then it is released out or sent out of the body through urine. So whenever this kidney functioning is less or the kidneys do not work properly, this urea and creatinine tend to accumulate in the body. So as this urea and creatinine accumulate in the body, you tend to develop renal failure. So, and this severe rise in urea and creatinine can lead you to hemodialysis. So here you need to follow a few precautions to prevent a person from progression of CKD and developing dialysis. So the first thing is diabetes control. So almost in India, more than 10 crore population is suffering from diabetes, and it is the most common cause of chronic kidney disease in India. So out of this diabetic population, more than 30% can develop chronic kidney disease, and then few studies say that there is something around 50 to 60% of the population are not diagnosed with chronic kidney disease in diabetes. So it is very important for patients with diabetes to regularly screen for chronic kidney disease. And then you should maintain a HbA1c between 7 to 8. Uncontrolled high blood sugars for a prolonged period of time can block your nephrons, can block your filtering units in the kidneys and can lead to increased urea and creatinine. And second thing is hypertension. So hypertension or high blood pressure is the second leading cause of chronic kidney disease in India. So prolonged high blood pressure can damage the blood vessels and reduce the blood flow to the kidneys. And this can lead to worsening of chronic kidney disease. So there are so many medications that are very good and that can control hypertension. And it is very important that all patients with hypertension should maintain your BP between less than 140/90. It is very important to be on regular follow-up with a nephrologist and control your hypertension. So hypertension, the one interesting aspect is hypertension follows a cycle. So patients with kidney problems can have worsening of hypertension, and this worsening of hypertension can in turn damage your kidneys. So it is very important to control it. And third important thing is protein leak in the urine. Protein leak in the urine is usually caused due to various causes. So once if protein leak in the urine is suspected, your nephrologist will advise for a basic blood test and then identify the cause of protein leak. So this protein leak in the urine can be controlled with few medications such as ACE inhibitors or ARBs, which are very good medications which control both your hypertension and also protein leak in the urine. It is very important to control protein leak because high protein leak in the urine can lead to rapid progression of kidney failure. So it is important to identify this aspect and treat it. And last and final most important aspect is diet in patients with chronic kidney disease. So patients with chronic kidney disease, usually there are so many misconceptions about diet. The first thing is about protein intake. Usually this protein is digested in the liver and then urea and creatinine are formed as waste products of protein. So whenever you reduce protein intake, for sure you will have low urea and creatinine in your blood. That doesn't mean that your kidneys are functioning well. It means that you are not taking food properly and then this can lead to malnutrition. Proteins are very important aspect in anybody's diet because 75% of a person's body is made up of proteins, and it is very important for immunity and also for daily wear and tear functioning of tissues. So if you don't take enough protein, your immunity tends to come down and then you can develop more infections, and this can in turn worsen your kidney function more rapidly. So the ideal amount of protein intake for a CKD patient is between 0.6 to 0.8 grams per kg per day, which is around 48 grams for a 60 kg person. So coming to us, since we are Indians, our Indian diet contains a lot of vegetable protein and it is already restricted or low protein. So we don't have to restrict protein much, and apart from that, we can take daily an egg white, which is not a problem. Especially for Western diet, where people take non-veg food for all the meals, that is considered high protein diet, and ideally that should be avoided in patients with chronic kidney disease. Second thing is salt intake in diet. There are so many misconceptions in salt intake. You should not completely stop taking salt. You should take restricted salt. It should be between 3 to 5 grams per kg per day, 3 to 5 grams per day. So ideally, refined iodized salt is preferable, but a lot of people have some doubts that whether pink salt, rock salt, or whatever salt, what is a good salt for patients with chronic kidney disease. So ideally, all the salt, varieties of salt contain sodium chloride. So it is important that you maintain salt intake to 3 to 5 grams per day. And there are some salt substitutes called low salt substitutes. These substitutes contain potassium, and these should be avoided because high potassium food can affect your heart and lead to heart failure. So it's better to avoid these salt substitutes. So coming to diet, usually a well-balanced diet should be taken. The trick is not to take anything too much or too less. You should follow a well-balanced diet. So any patient with chronic kidney disease should follow these important aspects and should take a well-balanced, adequate diet. There are some medications which can control urea and creatinine, such as alpha keto analogs and pre-probiotics. But without following the above measures like controlling blood sugar, controlling BP, reducing protein leak in the urine, and following a well-balanced diet, these medications do not work to control your renal function. So stay safe, keep your kidneys healthy.